Thanks, everybody. Just to let you know what we'll be covering today, just so that you know what we're signed up for. So I'll just give a bit of an overview about personalised care in cancer specifically. We'll also cover the cancer care review and also thinking about the implications of these times of COVID and the impact that that's had on people living with cancer and how we can support them. And we didn't want you to go away with, we really wanted you to go away rather with some things that you can use in practice. So we've got a few resources at the end of the presentation that would hopefully help you in supporting patients living with cancer and helping them to signpost appropriately. So just to start then, you may well have heard us talk about living with and beyond cancer for many years, and really it's just to kind of point out the change in vocabulary that's happened over the last, I suppose, 18 months. So now we're bringing what we would have understood as living with and beyond cancer into the wider personalised care agenda, and fitting that in with a comprehensive personalised care model for all health conditions. And just to kind of really spell that out, I'd love this. This is my favourite infographic that was developed with patients together and people with all sorts of health conditions, and it really just demonstrates that shift in relationship, really putting into focus the question, asking the patients the question rather than what matters to you, moving it to asking patient what matters to you. And it's incredible that the change responses you get and the shift in what people want to work on by just simply asking that question. So what does that mean for people living with cancer? I think it's given us some really great opportunities. I'm a rehab specialist by background, and I know that the living with and beyond cancer bit traditionally has often been viewed as the nice twiddly bit you do at the end when everything important is finished. And I think changing that vocabulary to personalised care really does give back the focus that this is relevant throughout the whole of the cancer pathway, from the minute you're diagnosed or even before, right the way through every stage of the pathway. And we'll explore that in a little bit more detail in a minute. I think it really focuses on we don't have to make assumptions about what the needs of patients are, that they have to be identified and addressed, and we've got ways of being able to assess those quite systematically, so people have the opportunity to tell us what matters most to them. Those needs will change. Certainly we see that as people progress through their cancer treatment, their priorities really change, and the things that they're concerned about most. So that reassessment needs to happen regularly. And it's, again, traditionally, I think personalised care was probably, or living with and beyond cancer was often seen as the role by the rest of the cancer specialists as the role of the CNS, but actually it's really putting into focus that it really is everybody's responsibility to support people, and that really trying to remind us that people aren't defined just by their cancer, and their personalised care needs are much more holistic than what they've come to the hospital with their diagnosis of cancer. And again, giving that element of giving the control back to the person with cancer, so that they're wanting to work on what matters most to them. So this infographic really just highlight what we've been talking about, that really personalised care needs to be addressed really at every stage of the cancer pathway, and often people will loop back into the cancer pathway if they get recurrence, or if their cancer is incurable but treatable. So that's just to kind of highlight that really. So what do we mean by personalised care? I mean, we've got the green man in the middle of this big circle, and I think I've already highlighted that that's really the essence of personalised care. It's making sure that our patients are active partners and are at the centre of everything that we do. So there needs to be a supportive conversation with the patient, and we utilise a tool called the Holistic Needs Assessment, which is specific to cancer, which goes through many of the things that people need to may be concerned about in their cancer journey, and actually asks them outright, you know, is this a concern? So it might be around physical needs, it may be around more psychological or spiritual needs, or practical needs. So things that maybe traditionally hadn't been asked about when we were seeing patients after a diagnosis of cancer. It's around providing information as patients need it, and obviously, you know, in this COVID world, we're really kind of capitalizing on what we can do digitally, but understanding that that's not going to be the right platform for everybody. I've mentioned the holistic needs assessment as that kind of structural way of asking and supporting that conversation, and that would lead to a care plan that the patient that the patient owns and takes forwards. And most importantly, it's being then able to signpost into services that would most support the patient's needs. So I think I've mentioned a couple of things this times. This isn't a nice to do thing. This slide just demonstrates our drivers. So for personalised care, actually, embedding these opportunities to assess people's care needs and helping them plan for those is a national deliverable that as an alliance we have to report up to the national team and are monitored on, along with supporting kind of more self-management for patients in certain tumour groups, and the quality of life metric that has just started to roll out for our breast, colorectal and prostate patients. COVID, again, we've been asked by the national team to accelerate some of these things, recognising that I think certainly first wave, and we're seeing it again this wave, that being able to address patients' care needs during COVID were the first things that had to drop, and we definitely saw the impact of that further down the line as we were recovering post-COVID the first time round. So I think we've been asked by the national team to try and accelerate embedding some of these interventions. Just a little bit about the personalised care programme in the Cancer Alliance. So as I've mentioned, we are wanting to embed personalised care interventions, but really it's then making sure we've got the services in place that we can signpost people into. It's no good kind of highlighting a need and then not knowing where to send it or not having a service to refer into. So the programme that I manages all of these things on this slide, specifically around kind of cancer rehabilitation, lymphedema management and psychology services, and using our social prescribing resource in the community as well. And just when I'm talking about personalised care interventions, this I think might be my last slide, really, you know, what we're going to kind of focus a bit more on today is the element that's routinely delivered in primary care, which is the cancer care review, and how that fits into a whole package of interventions and a way of assessing patients' needs on an ongoing basis. Just to give you an idea, I think this is good to have in your minds as we move on to the discussions around the part of the presentation around cancer care review. So this slide was taken, I think this was from the GUISE data, and it was the holistic needs assessments that were done over a year period. And there is some variation of symptoms that patients express in different tumour groups, and the top 10 do change in rank order over time during the patient journey. But what's really stark is, on the whole, these top 10 concerns don't really, they're not specific to the type of tumour that patients get, and they're expressed over and over again by our patients. So you can see here is a real mix of both physical, psychological and very practical concerns that patients have that pose real barriers to patients being able to come for their treatment or complete their course of treatment. So just to give you a flavour of the things that they bring up on a very regular basis. So I'll now hand over to Esther, my colleague, who's going to talk a bit more about in more detail about cancer care reviews.
Thanks, Sam. Yeah, I think that list that Sam's just highlighted is really important to hold in your mind while we're talking about cancer care reviews. And I think also, as Sam's highlighted, cancer care reviews are really a fundamental part of personalised care. I think we're all aware of over the last years how cancer has become, whereas perhaps when I was a child, it used to be something that people tended to be diagnosed with and died with. Now it's very, very much something that people often live with indefinitely in many cases. As you can see, sort of the average survival in 1970 was about 1 year, and up until very recently it was 10, and now it's more than 10 years in many cases. And by 2000 or by 2030, we're likely to have about 4 million people living with cancer. So that's going to be an awful lot of patients that we're actually looking after who are going to be in that situation. And the vast majority of those are going to be over 65. Next slide, please, Sam.
Yeah, sorry, my slides.
No, that's okay. So if you hold in your mind that 4 million, a quarter of those are actually going to be facing poor health or disability after their treatment, which is actually, we're looking at 1 million patients. 1 million of our people are the people that we see on a regular basis. Over 70% of those people living with cancer are actually going to have emotional needs. And sort of 2 in 5 with depression or 1 in 10 with anxiety. So those are huge numbers, and that's clearly having a massive impact on their lives. And 4/5 are actually going to have a financial impact as a result of their treatment as well, which is again going to have a very quite a catastrophic effect on people, given the enormity of a cancer diagnosis and recovering from the treatment. On top of that, having to deal with financial concerns is more than most people would imagine. Next slide, please. So obviously, if we're looking at an older population who are living longer with cancer, then a lot of these people are going to have coexisting health problems. Up to 70% of people are going to have an existing medical condition. So this is just a range of what they might have, but obviously some of these conditions might put them more at risk of cancer through lifestyle or risk factors generally. But obviously these are going to have an impact on their risk of recurrence and their ability to actually recover from treatment as well as the initial diagnosis. Next slide, please. Thank you. So this is sort of the range of needs that people might have. And these are actually quite high percentages when you consider it. 64% needing practical or personal help. And as we highlighted before, a lot of people with emotional needs. Next slide, please. So if we're looking at an average practice of about 8,000, 280 patients on that list will be living with immune cancer, and that's going to be doubling over the next decades or so. Some of these patients may have been diagnosed quite some time ago, but in fact that's actually a time when they may actually start to develop late effects, so we need to be really aware of that. Quite a number will have unmet needs that they might not actually feel are justified in mentioning, and so the cancer care review is really an opportunity to try and draw those out. So there's obviously going to be a big impact on quality of life in the long term, and that's going to affect up to a quarter of patients. Next slide, please. So this is a slide that summarises one of the questions from the National Cancer Patient Experience Survey, and it asks patients who've had their treatment, did general practice staff definitely did everything they could to support patients during treatment? Now, when you consider that you know, we see a lot of patients, we've got a lot of patients on our list, and we like to think that we're supporting people through whichever health problems they have. The actual percentage of patients that felt that they were being well supported was actually pretty low. The national average is 58%. And, you know, looking down at most of the CCGs in South East London, only one of them actually sort of reached that and was actually slightly more than that. And I know the borough that I work in, Lewisham, our levels of our percentage of patients that felt that they were being supported was really low. And obviously the Cancer Care Review is a really good opportunity to engage with patients and support them and actually signpost them to the resources that they might need to support their recovery. Next slide, please. So a Cancer Care Review is either virtual in this climate or face-to-face, and it's a dedicated appointment. And by making it a dedicated appointment, we actually give patients license to talk about their concerns and their cancer. Ideally, we could actually prepare them for it by sending them a checklist and actually inviting them in and letting them know what they're coming for. There's a template that Macmillan developed to actually support the Cancer Care Reviews, and that's available on all the GP IT systems. It's an opportunity to explore the patient's understanding of what they were coming for. And if you've managed to get the holistic needs assessment from secondary care, which we should have, it's an opportunity to follow on from that. Utilising social prescribing or our normal referral routes within primary care, we've got an opportunity to send them on to services that they can support, that they can be supported by. And we can provide general information and health promotion as well. There's a very, very good YouTube video on Cancer Care Reviews that I'd really encourage people to look at some point, and this will be included in the slides. Next slide. So this is the template. These are screenshots taken from EMIS, and I imagine it looks fairly similar in all the other GPIT systems. And although this first page looks quite busy, it's actually quite straightforward to fill in, and it's a really, really good aid memoir of things that you should try and address with patients. So things such as the type of treatment is very, very important to actually document, because that could have an implication on late effects that you'd be looking out for in subsequent reviews. The other things about highlighting what complications they might have had at the early stage, because they may need ongoing monitoring. So I'd really encourage people to use the template, because it does provide a really good way of ensuring that you've actually covered all the areas. And then if we go on to the next slide, please. There's information from the Macmillan website. And actually, one point, if we can just go back to the previous slide. Thank you. The prepay exemption is actually really important. And I've been amazed at the number of patients who've had cancer treatment for several months, and no one's actually mentioned to them that they're entitled to free prescriptions. And given that their use of NHS services and prescriptions is going to likely increase significantly during their cancer treatment, that's a real omission on our part. Thanks. If you could just go to the next slide. So there's a lot of information that's actually embedded in the template as well. And a lot of these, particularly if you come across areas of sort of information needs that the patient has, one really good place to look is the Macmillan website, because that often gives information, and also the Cancer Research UK website as well. Okay, next slide, please. Those people who are, or those colleagues on the webinar who worked in Lewisham will have actually taken part in the Macmillan Primary Care Toolkit, and other people may have used it as well. It's a very comprehensive project, effectively, that Macmillan developed to actually improve the quality of cancer care in primary care. One of the areas is encouraging the use of Cancer Care Review templates, the Macmillan one. And it shows here 2 columns before the use of the toolkit, what was included in Cancer Care Reviews, and then after the use of the toolkit. Before the toolkit and after the toolkit use. And it's about using a Cancer Care Review template during the Cancer Care Reviews. And it shows that by using a Cancer Care Review template, you actually end up covering a lot more topics than you would do otherwise, which is obviously really important. Okay, next slide. And at this point, I was going to hand over to Anthony, who's going to talk about the Right by You and social prescribing and the changes that we've had to deal with since COVID. Thanks, Anthony.
Thanks, Esther, for that. Just to clarify, regarding the templates, they are aligned in all the IT systems. So if you are one of the Vision or System 1 users in South East London, the templates will be available, the Cancer Care Review template will be available on your systems, and it will be exactly the same. It won't look the same, obviously, because of functionality differences, but all the information and automatic coded information and the links to Macmillan information are the same. So they can be used in all the systems. Okay, yeah, so I'm going to talk briefly about social prescribing, and then we're just going to touch a little bit on the impact of COVID on people living with cancer, specifically on how primary care can support people through this time. Social prescribing obviously has become much more prominent within primary care over the last 2-3 years, and most of us now will have, potentially multiple social prescribers working within our primary care networks. And at Macmillan, we've done a lot of work to really try and highlight how important social prescribers can be in supporting people living with cancer. And we've delivered quite a lot of training, and there's a lot of training available if you'd want it for your areas to support social prescribers to have the confidence to manage people living with cancer, because for them it really is no different than seeing people with any other long-term condition, really. So I think we've already highlighted that really personalised care does need to be everybody's business, because not one individual within a primary or secondary care team can manage someone's needs. So we have to work together and really signpost to each other so we try and meet everyone's needs. Social prescribing is super important in promoting self-management and helping individuals identify their needs and empowering them to identify ways that they can, not only ways that we can help meet those needs and ways that we can signpost to meet those needs, but also empowering people to identify the resources they have within themselves and within their own networks to meet those needs as well. Not only individual benefit, there is system benefit from social prescribing as well, with some evidence around reduction in GP attendances and A&E attendances of people who've had social prescribing input. So that's just an image of some top 10 tips we have created for social prescribing, which is all on the Macmillan website, which I think the link is for at the end of this presentation. We've also prescribed, so that's a top 10 tips for GPs and for nurses around social prescribing in primary care and for social prescribers as well. But we've also prescribed a network guide, so which is just a few pages long, to really support primary care networks to understand how social prescribing can help them support the people living with cancer in their footprint. So just going to focus a little bit on COVID-19, and then we'll have plenty of time for questions if there are any. So some changes which obviously you'll all be very aware of. Most of us have seen a very significant increase to mostly virtual appointments. And this isn't only affecting us in primary care, it is secondary care as well. So there is a concern for people who are diagnosed with cancer throughout this time, and up for the last 12 months now, essentially, and having been treated for cancer over the last 12 months, that they might not be receiving that wraparound holistic care from their acute trust that they might normally receive for obvious reasons, for capacity reasons, and for consults being moved to virtual consults. So it can be more difficult to provide some support, especially psychological support, pastoral support. So we just need to be aware that people might not be getting the support we might normally presume that they will be doing. We certainly saw as part of the first pandemic, and we are seeing again that treatments are being reviewed. So particularly surgery, people's cancer surgery is being reviewed at the moment, and we are seeing some capacity issues within the trust to be able to deliver cancer surgery. And patients may have a lot of questions around this. that they would hopefully be able to have the ability to ask their acute teams, but they may be coming to us in primary care with these questions as well. People with delayed treatment and people who are clinically extremely vulnerable may be worried about how things are going to progress during that time, and worried about deconditioning, especially because they will be isolating indoors. So we need to be able to establish how we can support them virtually with these concerns. We'll come to some of those solutions shortly. Certainly, I'm sure all of us are seeing within primary care, and this is not in any way specific cancer patients. We're all seeing that anxiety levels amongst the public are very, very high, and perhaps not even specifically related to COVID, but potentially more related to the changes in lifestyle and outlets that we've seen over the last 12 months. And certainly for cancer patients, we'll look at a few quotes in a minute. We have seen significantly increased levels of anxiety within cancer patients that are waiting for treatment and unsure if they've had changes to their treatment, what that might mean for their prognosis, or if changes to the treatment are going to happen because of the very rapidly changing situation with COVID. Also, treatments may be in new sites, so people might not be going to the trust that they're used to receive their treatment, particularly surgery. And we are using some independent sector capacity to deliver some cancer surgery. And again, they won't be set up to deliver the holistic care that people might get through the information centres and through the support workers and the CNS contact that they would receive in the trust. So I'm not going to go through those quotes. I'm just going to leave them up there for a minute. These are some research we did through the first wave of the pandemic to assess the impact on people living with cancer that had been diagnosed during the pandemic. And I'll just, some of the quotes there aren't necessarily surprising, but they are concerning and are useful to reflect on when we think about how we can help people that are having these problems. I'll just leave that up there for a few more seconds. Do you want to move on the slide? So primary care support for people living with cancer during this time really might be more important than ever, as we've already said. People might not be receiving the support in the normal way, and so it's perhaps more than ever that we reach out, even in a high-level soft touch way, to people living with cancer. Certainly people diagnosed with cancer at this time or going through treatment for cancer at this time, so we can make sure that they're receiving all the support that we can help them receive. People are still being diagnosed with cancer and going through treatment at this time. I think more than ever, certainly at Macmillan, we'd always say it's really important for a primary care to reach out at the time of diagnosis anyway, but it's probably even more important at the moment to highlight what support is available. A lot of this might be virtual support, and we're going to look at a few of the direct services that organisations like Macmillan offer that are available to anybody at any time across the UK, so that people might be able to seek out other sources of support that they might not normally feel the need. Again, information as well, really important for us to find ways that we can support, provide people with information. We've been extremely nimble within primary care and moving to virtual consultations and using services like AccuRx that have been, in my opinion, revolutionary in how we can send information to people. And it's really important to think about how we can use these for specific situations. Cancer care reviews really still important to do. These can be done virtually through video consultations or telephone consultations, through use of the templates to really try and guide and structure those conversations, and through, often we can then signpost people directly by use of services like AccuRx, or for our social prescribers that are using other services such as Elemental potentially in signposting people to information via these digital solutions. If we are concerned about physical problems, some of that might be signposting back to the acute team, or it may be that we do need to arrange how we can see people face to face in a safe way. Do you want to move on? Just a brief mention on clinically extremely vulnerable patients. Obviously, shielding was a big issue in the first pandemic. We stopped using the word shielding, and the categories changed, but certainly, the shielding for clinically extremely vulnerable patients has been re-implemented now from a national guidance point of view. We need to be aware that people might not be able to access the support they normally would. People might be even more vulnerable than normal because they're living alone, so loneliness, access to support and simple things like food is difficult. because of the vulnerable status. They may have had treatment delayed or cancelled, and they may have real concerns and questions about this. And obviously, you know, cancer aside, people with cancer will have other health concerns as well, and they might not be aware of how to access support on them as because of those as well. And a bit of a flag here for social prescribers and link workers, absolutely. It may be that for a lot of these non-medical concerns, a lot of this pastoral element, that our social prescribers really could come into their own here. We have a social prescribing service in Hammersmith. When I say we, Macmillan has a social prescribing service that we co-fund in Hammersmith and Fulham. And through the first wave, we saw over 5,000 contacts for people living with cancer through that first wave, and it just really highlighted how important social prescribers are to support people at this time. I'm just going to mention a few services here, and these are services that we could just signpost people directly to, send a link via AccuraRx, email, whatever that might be, so that people can look at the ways they can seek support. So on Macmillan website, we've got the general website, we've got the diagnosis website, and we've got the coronavirus hub. So the coronavirus hub can be found by this link. It's got a professional section and a section for people living with cancer. And the people living with cancer section has a whole heap of information on there about ways people can be supported through this time. One of which is the Macmillan support line. So we have a support line that's on 8 till 8 every day. And people can ring up the support line essentially for any concerns. If the person that they're speaking to can't meet their needs, they'll be able to signpost them to hopefully someone who can. And this can be medical needs, so they might have questions about cancer and treatment, and they'll be able to speak to CNS, or it might be non-medical needs, and they'll be able to be signposted to somebody with specialist information in that area, such as financial issues, back to work problems, things like that. There's a Macmillan online community. I think as GPs, we're not great at signposting people to online communities, but we certainly hear from a lot of our patients that this is where they get most of their support and from their peers. The online community is also 24/7, so it's a real resource for people who might be suffering from worries and anxieties at a time when the support line's not open, at a time when they can't get hold of their acute team or the primary care team. So really just flagging to people that they might, you know, if this is something that they might be keen to engage with, people might be engaging with online communities for all sorts of things and not realise that these communities are there for to network with people and share experiences with people in similar situations to them. Information on the Macmillan grants there, so people can access individual grants that are means tested, and they do need to be referred by a health professional, but the referral form is literally 2-3 minutes of a job. So you know, you feel free to send your patients with cancer information on access to Macmillan grants. Move on to the next slide. I am going to mention 2 more things that weren't on there, and if they're not on the next slide, which they might be, in fact they might be on the next slide, so I'll pause. These are some of the Pan London resources that are available as well. So these aren't Macmillan resources, these are resources that have been created by the 4 cancer alliances across London. So Sam, who was speaking earlier, has been very involved in creating these websites. The first one, I mean, initially was a website that one of the main reasons it was set up was so people could go on this website and book into health and wellbeing clinics that were being held at a time or a location that was suitable for them. Obviously, people aren't going to face-to-face wellbeing clinics at the moment, but there is lots of other information on there that can still be really useful for people at the time going through treatment. And then there's the Cancer Care Map, which is a little bit like the Macmillan in your area, where people can just go and put in their postcode and see what are the different cancer, either local, it might be local support groups, it might be NHS support services that are available in their area. So again, these can be really useful websites for people to be sent the URLs to. And then these are just information on the cancer information support centres that we have in all our major trusts. I mean, Sam can correct me, but I don't think any of these are open for face-to-face contact at the moment, but they will be able to support people virtually. The websites are there to either share or go on yourselves and see what information there is on there. And then, so I can see there is a slide that I'll try and get sent out separately, because there are 2 other services that Macmillan are offering at the moment. There's something called SafeFit, which is a prehab service. So for patients particularly that may have treatment that's been delayed because of COVID and worries about deconditioning, they can have access to some prehab support that they can do in their own home, and some people can get access to personal trainer sessions as well to support them through that. So we'll make sure that link's sent out as well. And one service we had in the first wave that was then cancelled, but I've just had confirmation that it is restarting, is a telephone befriending service. For anybody that might be isolated at home, they can have sessions with a telephone befriender, so to try and help them with, with pastoral support through difficult times. So we'll make sure that that information is sent as well. This is a slide on the Macmillan Primary Care webpage. The URL is there. It doesn't look like this at the moment because our digital teams are going through a rehash of the website, but all the information is still there. And this is essentially all our information in one place, all our information for the support primary care professionals in one place. Okay, so one thing I think I will just promote while we're on here then is through the pandemic, we are going to be sending out weekly primary care comms from the Cancer Alliance to try and update you on any changes that might be happening. And we're hosting a weekly drop-in webinar as well. So every Thursday from 1 till 2, I believe, we'll be sending out the link to join that through the primary care comms, but also we could perhaps send it to everybody who's on the distribution list for this webinar as well. And that is essentially just going to be a drop-in for anybody with any questions you might have that you might be facing with some of your cancer patients, or changes to pathways that you're not sure about, queries about tests, etc. Obviously, if they are specific to individual patients, it may be that we can discuss things generically, but we may have to take offline onto NHS.net if there are specific patients that you're concerned about. They're going to be starting tomorrow from 1 till 2. Please do share that information with all your colleagues. And obviously that's just drop in, so you can come in and stay, but you might just want to drop in, get your query answered and then go away as well, so you're not picking up too much of your time. And we're going to run them over the next few weeks and just see what the need is there. Also, one other point is that the Rapid Diagnostic Centre is going to be going on to Consultant Connect. So we're going to have kind of some vague symptom support on Consultant Connect, which will be really useful through this time if there are people that you're really not sure about whether you should refer into secondary care on a tumour-specific pathway. You'll be able to ring up and get some medical advice either on whether they should be seen by the RDC or often things that maybe we may be able to do without sending them into secondary care, either as an interim or potentially, it might even be management advice. So that's going to be going live on Consultant Connect from Friday, I believe. But again, we'll get that information out via the comms, and that might be particularly useful. We're conscious that there may be the odd patient that is on a tracking list within secondary care because of delays, and you might be concerned that they are deteriorating and not sure who to contact. And again, either using that drop-in webinar or emailing your cancer lead or myself, or using that Consultant Connect RDC line, maybe support for you guys through this time when you might be a little bit lost as to what to do for patients as well.
Anthony, I've just put in my email address in the chat. So if anyone would like me to send them the diary invite for our drop-in sessions, then my email address is there. So please just email me. I'm happy to forward that on.
Fantastic. Great. That's nothing more from me. I don't know if there's anything more from Esther or Sam.
Brilliant, thank you. And alternatively, if you've got any questions around the content, or if you want to know any further dates around the webinars, then happy to send that out to you as well. And just to say thank you so much for attending. The video of this will be available on our YouTube channel, and an email will be sent to all attendees to confirm that that is available. So just to say thank you so much. Have a nice rest of the day, and please take care of yourselves. Thanks, guys.